Hey everyone, and welcome to today's Explainer. We're going to be diving into a super common, yet honestly pretty misunderstood condition hernias. We'll be walking through the entire clinical patient journey, starting from how this physical problem actually begins, straight through to the clinical interventions and the essential nursing care that brings a patient back to full health. Okay, let's look at our roadmap for today. We're going to cover what a hernia actually is, the four main types, the causes and symptoms, how we diagnose and treat them, and finally, essential nursing management. Let's get right into it. Section 1. What is a hernia? The anatomy of the escape. So think of the cavities inside the human body like sealed, secure rooms. They're designed to keep our organs safely locked exactly where they belong. But what happens when an organ decides it wants to break out? Basically, a hernia is when an internal organ, or even just a part of it, physically pushes and protrudes right through the protective wall of its containing cavity. It forms this visible lump or swelling outside of its designated area. It's literally an organ escaping its room. Section 2. Four main types of hernias, categorizing the locations. Right, so now that we know what this structural breach actually is, we categorize it based on where the organ is trying to escape to. First up, we have hiatal hernias. This is when an abdominal organ pierces upward through the diaphragm and right into the chest cavity. Then you've got umbilical hernias, where the intestine protrudes near the navel or belly button. Third are surgical hernias. These happen at the site of a previous surgery, like a C-section scar, where the bodily wall is already weakened. And finally, inguinal hernias. These occur down in the groin, where an organ passes through the inguinal ring, sometimes descending all the way into the scrotal region. Section 3. Causes and symptoms, the patient experience. Now, these physical shifts, they are incredibly painful for the patient, and understanding the root causes is absolutely crucial for giving them real empathy. There's a pretty simple logic at play here. Anything that creates intense upward or outward pressure inside the body, like heavy lifting, severe exertion, or a chronic cough, well, it literally forces the organ to seek an escape route. Pair that kind of intense pressure with bodily walls that are already weakened from old age, obesity, pregnancy, or past surgeries, and you've basically got the perfect recipe for a hernia. And the symptoms really reflect just how severe the structural breach is. The most obvious one is a protruding lump and localized pain. It can get so bad that just walking around becomes incredibly difficult. But I really want to highlight the hiatal hernia for a second. Because the stomach organ pushes up into the chest cavity, it uniquely restricts lung space. So on top of typical stuff like epigastric pain and vomiting, these patients also face severe chest burning and terrifying difficulty breathing. It's a huge deal. Section 4. Diagnosis and medical treatment, fighting the condition. So this is where the medical pros step onto the battlefield. It all starts with pinpointing the exact location of that escaped organ. A physical exam is always step one, but we really need to look inside. That's where diagnostic tools like barium X-rays, CT scans, MRIs, and ultrasounds come in. Think of them as our internal maps. They allow doctors to precisely locate the rogue organ before making a move to treat it. Okay. So we've found the organ, we know exactly where it breached the cavity wall. The big question now is, how exactly do we treat a hernia once it's diagnosed? How do we get that organ back where it belongs? Well, the crucial point here is that we have two main physical solutions, and they are definitely very different. First, we have manual reduction. This is an immediate, hands-on approach where a clinician applies gentle manual pressure to physically push that organ right back into its cavity, with absolutely no surgery required. But if that doesn't work, we turn to the definitive fix, surgical repair, clinically known as herniorrhaphy. This is where a surgeon physically returns the herniated organ to its original place and then firmly stitches that weakened cavity wall closed so it simply can't escape again. Now, while surgery fixes the actual structural issue, it doesn't instantly solve the patient's discomfort, right? That's where medical management comes in. We're talking analgesics, medicines like paracetamol, tramadol, or even morphine for the really severe cases to manage that intense pain. Then antacids like pantoprazole 40 milligrams or ranitidine are used to fight off heavy epigastric gas and burning. And of course, antibiotics are deployed post-surgery just to make absolutely sure we prevent any nasty site infections. Section 5. Essential nursing management, guiding the recovery. Look, fixing the anatomy is really only half the battle. Guiding a patient safely through recovery requires strict adherence to clinical protocols, and the precision here is actually fascinating. Before surgery, nurses make sure the patient is kept NPO, meaning nothing by mouth, for a solid 8 to 10 hours. Then, post-surgery, the head of the patient's bed is elevated 6 to 8 inches to relieve abdominal pressure. Nurses also continuously auscultate or listen to bowel sounds to make absolutely sure the digestive system is safely waking back up. And this next part brilliantly illustrates how interconnected our bodies really are. Nutritional care is huge. We provide a high-protein, low-fat diet to speed up tissue healing. But notice this big medication warning. Anticholinergic drugs must be avoided. Why? Because they alter how fast the stomach empties. If it empties too fast, it creates extra space and alters the internal pressure, which seriously risks shifting those organs all over again. It's a super delicate balance. Which brings us to this incredibly important golden rule. Advise the patient to chew food slowly and properly to prevent indigestion, constipation, and dangerous abdominal pressure. Seriously, it sounds so simple, right? But it is absolutely vital for long-term patient recovery. Chewing thoroughly prevents the kind of digestive backups and straining that spike internal pressure, which, remember, is the exact pressure that caused the hernia in the first place. All right, we've covered a lot of ground today, from the physical mechanics to the clinical treatments and nursing care, but I want to leave you with this final provocative thought. If a hernia is simply an organ escaping its boundaries due to internal pressure, what daily lifestyle habits can you change today to protect your body's walls tomorrow? Think about it. How you lift heavy things, how you eat, how you manage your overall health, it all plays a crucial part in keeping your anatomy exactly where it belongs. Thanks for exploring this explainer with me, and I really hope you've walked away with a much deeper understanding of the clinical patient journey.